Hello everyone, welcome back. It's been a while since I uploaded a video. It's just been very crazy year and semester. So this will be a continuation of the histology topic. We're on to connective tissue. So from this slide, you can see the different types of tissues that we have, which I will be talking about today. We have blood, compact bone, and hyaline cartilage. So first, let's talk about the features of the connective tissue. So it's the most abundant and widely distributed in the body. I always just like to say, when it doesn't fit into epithelial tissue, it doesn't fit into muscle tissue and nervous tissue, then we just put all of it into the connective tissue section. So they're very vascularized, highly vascularized by now. Everyone should know what vascularization means. It means it has a lot of blood vessels, with the exception of cartilage, and also innervated. Innervated means that it has nerves. Again, cartilage is an exception. Cartilage is not vascularized and is not innervated. So a quick review of epithelial tissue. Epithelial tissue is not vascularized, however, it is very innervated, okay? So, because this could be on the exam where you're being asked, which one of this is vascularized, non-vascularized or innervated. So this is very unique to cartilage. Highly vascularized and innervated. So the main functions of all these connective tissue, all of them will have all these general functions like binding tissues together. We see that in bone and cartilage, supporting and strengthening tissues. We see that in tendons and ligaments, elastic cartilage, protecting and insulating organs. Example of that would be adipose tissue, and transportation, which will be blood. So this diagram right here, I especially like it because it just gives you an idea of what connective tissues have. So all of them will have all of these, however, in variation. So some might have like more elastic tissue than others. Some might have more melanocyte than others, and so on. But you get the point. So the first thing I want to talk about would be the background. The background, which is like this pink thing you're looking at. This is the ground substance. I like to call it like the background, the filler. This is where the foundation is. And then we're going to see another obvious thing, this brownish, yellowish thing that looks like stripes. These are collagen fibers. Most people would think like, oh, collagen in your skin, but I always say, hey, collagen is in connective tissue. And obviously we know, when we get to the integumentary chapter, we're going to be talking about collagen fibers as well. So we're going to see these collagen fibers. Like I said, some of these connective tissues will have more than others, right? There are also other obvious ones like elastic fibers. These bluish strings that you see, these are the elastic fibers that we're going to see common among connective tissues. And other things we're going to see would be reticular fibers we see here. This is a melanocyte, which is going to be the one that will make melanin. So obviously, if we're in the skin with dense irregular connective tissue, we're going to see melanocyte. We're also going to see blood vessels. So if you remember, I said they're highly vascularized. So we're going to see like blood and vessel. We see another one right here. We're also going to see adipocytes. Adipocytes are fat cells. Do not confuse adipocytes with adipose tissue, all right? So fat cells, we're obviously going to see a lot of them in adipose tissue. And then we're going to see other substances we're going to be talking about later on. Mast cells is in here. Free macrophage, which will help clean up any debris, or, if we have like an old cell that's not supposed to be there anymore, they're going to clean all that area up. We also have fibroblasts here. We're going to be talking about fibroblasts. We're going to see this in bone when we get to bone histology, and lymphocytes. So these are like the main features or cells that we would expect to see in connective tissue as a whole. Not to mention areolar connective tissue, we tend to see this in the lungs. In the lungs. So what does this tell us? This tells us that your lungs are basically like sponge. They're going to soak up any water, in cases like pneumonia, for example. We saw the case with COVID, people not being able to breathe. The purpose of your lungs are not to, be filled up with fluid, but so that they can be filled up with, oxygen, the gases, with air, right? So if there's any fluid around the lungs, it just accumulates because it has a lot of areolar connective tissue. So the next one is going to be the adipose or fat connective tissue. We find this in the subcutaneous layer of the skin. When we get to the skin, we'll talk about that. We see this in joints, helping to absorb shock, which is what cartilage does, but fat also helps. We see it in the abdomen. We're going to see the connection later on. For example, when we use the term subcutaneous injection, why is it that we always put it in the abdomen? Why? Because that is the abdomen contains a lot of adipose tissue. So the and most medication, by the way, that we gave subcutaneous, like insulin shots, they work really well with adipose tissue. The absorption is going to be a lot quicker and faster. So what are the functions of adipose tissue? They reduce heat loss. There's a reason why we have them underneath our skin. Sometimes people are like, oh, I don't want this fat here. But there's a reason why. It reduces heat loss. It also serves as padding. It has padding, for example, in our joints. It also serves as energy source. I mentioned this when I talked about the chemistry portion of our cell. Most people think, oh, carbohydrates, energy source, but long-term energy would be fat, would be adipose tissue. Carbohydrates are more for short-term, immediate source of energy. And not to forget is support and protect our organ. There's a reason why you have a layer of fat around your organs, like your heart, like your kidneys. Especially we see that again, like in the abdominal area. There's a reason why most people might think like, oh, that's so disgusting. No, it has a function supporting and protecting your organ. Can you imagine if you're running and all your organs are just hitting each other? But when you have adipose tissue, that actually prevents them from touching each other. So in this histological picture, we can see that adipose tissue are going to look like white bubbles. All right, so no one should see this and say, wait, is this epithelial tissue? Is it areolar? No. White bubbles with the nuclei, their nuclei, this purple thing right here, pushed to the sides. All right, they're pushed to the side. And this is very unique. If you remember skeletal muscle tissue, they have peripheral nuclei. So, when you're studying this, I would like you to, be able to compare and contrast. So like, okay, what other cell, what other tissue will have a peripheral nuclei? So these are large fat droplets, and each individual ones are fat cells. And where are we going to, other places we're going to see it besides the abdomen would be the breast. All right, we see within the breast. So when someone has big breast or small breast, it's not depending on the number of glands that they have. It's really a fat thing. All right. Again, we see in the buttocks area, if someone has a big butt or a small butt or no butt, it's really, they have a lot. Someone who has a bigger butt will have more fat. Someone who has a bigger breast will have more fat in their breast than others. So the next one will be reticular connective tissue. So this forms a scaffolding we used by lymphoid tissue. So what we're saying is we're going to see this more in our lymph nodes and our spleen. This is not really something we would expect to see in every single cell all over the body, like I said, in the lymph nodes. And when we get to the lymphatic system, we'll see that again, the lymph nodes are widely distributed all over your body. So you can see here the nucleus of the reticular cell, and we're going to see a lot more reticular fiber, that I mentioned earlier. We're going to see that here. So the next tissue is going to be the dense irregular connective tissue. We see this in the skin, So this provides strength when forces are pulling from different directions. You're working out, you're running, your skin can be pulled in different directions. We're going to compare that in the next slide with tendons and ligaments. You cannot be pulling your tendons and ligament in different directions. It's going to get torn. All right, it's going to get torn. But this unique feature, and going to the slide, we're going to see that the reason why we call it irregular, they don't have a certain pattern to it. And we actually find this in the dermal layer of the skin. We're going to talk about the skin when we get to the integumentary system again. And we can also find this in fibrous capsules of joints and organs, when you're saying like, oh, range of motion, the fact that you can, rotate your shoulder joint, for example, in a circular pattern, circumduction. This is due to dense irregular connective tissue. So we're going to see more elastic fibers here. We're going to see that fibroblasts is a major cell type here. The collagen fibers are arranged in a very irregular pattern. So compare that with dense regular connective tissue. One of the things I want you to see is that there's a certain pattern to this. This is not muscle. This is, I mentioned the stain, that we stained it pink. There's a certain pattern to it. So we find this in our tendons, in our ligaments. Tendons attach your muscles to bones and vice versa. And ligaments attach bone to bone. So one of the unique features here is you're going to see a wave-like pattern. Like I said, very few elastic fibers because you cannot, pull them in different directions. And we're going to see that the major cell type here is going to be fibroblasts. The next connective tissue is going to be blood tissue. Yes, blood is a tissue. Okay, most people think tissue has to be, solid. Blood is a tissue. It's a liquid tissue, and it's made up of red blood cells and white blood cells, platelets, and plasma. So we have three major cells here. The red blood cells you can see here are these hollow, pinkish structure that we see. But one of the things that you're going to notice with the red blood cell is that, wait a minute, where's the nucleus? Well, a mature red blood cell will get rid of its nucleus, will not have a nucleus. Why? Because the job of a red blood cell is to carry oxygen and carbon dioxide. And if they're, one of the things we've seen about a nucleus is that it takes up almost all of the cell. We can see that here with the white blood cell. The nucleus has taken over all of the cell. We cannot have that in a red blood cell. If a red blood cell is going to do its job, a good job, we have to dump the nucleus. Okay, so that's why you see the hollow center in all the red blood cells. And like I said, the white blood cells, these are variations. I have another topic where we're going to be talking about blood in its entirety. And platelets, you might see like, oh, what are these fragments here? What are these, like, are they just like, just ignore it? No, those are platelets. Those are, fragmented cells. They're fragmented cells. And plasma is going to be the background here. Like the ground substance I mentioned. So this is going to be plasma, which is the liquid, the clear portion of blood. And where are we going to find blood cells, blood tissue? We're going to find them in blood vessels. Okay. The next one is going to be cartilage. Cartilage is a tissue, and we have three different types of cartilage. But first, let's talk about the function of cartilage. The function of cartilage is for shock absorption. Can you imagine, especially people who run, if you're running or jumping up and down and there is no cartilage in your knee joint, in your hip joint, that would mean your bones will be crushing, rubbing against each other. And you have to understand, even though cartilage does not have nerves, you do have nerves in your joints. And, there's actually a condition for that. And that is called arthritis. All right. Arthritis is basically when there is not enough cartilage due to wear and tear or, for other reasons. There's no cartilage in that area. So what ends up happening is that the bones are rubbing against each other, which causes a lot of pain. And they're needed for protection also. I mentioned that they're avascular, meaning they don't have blood supply and they are not innervated. So someone might say, but when I pierce my ears or my nose, it hurt. Well, your skin, that's why I mentioned epithelial tissue. Your skin has nerves, so that part was the part that was hurting. And your skin, your dermal layer, not your epithelial layer, your dermal layer has blood. Your dermal layer has dense, irregular connective tissue, and that is supplying blood. And one of the things that we'll end up seeing in A&P is that anything that really doesn't have a blood supply, guess what? It's going to take a really long time to heal, or it's going to die. But because cartilage, this is its normal, normal use, this is how it's made, it is going to take forever to heal. So I'm sure when you pierce your ears or your nose, it took a longer time to heal than like if you even had a cut on your lips, because your lips are very vascularized. So onto the 3 types of cartilage tissue. The first one, they're not in any particular order. Hyaline. Some people call it hyaline. I call it hyaline. Hyaline cartilage. This reduces friction between the bones. And we tend to find them in synovial joints. I'll talk about synovial joints when we get to the bones. So you're going to find them in your nose, in your trachea, which is your windpipe, the ends of your ribs. Yes, your rib cage. You need cartilage because we need that flexibility. When you inhale, we want your rib cage to expand. And then also, when you exhale, we want it to go back to its original position. And so hyaline cartilage is especially important because it helps to resist compressive stress. And fibrocartilage is the next one. This is the toughest kind of cartilage. This limits movement. It pads your knee joints. You might see, joints again. Yes, we have different types of cartilage in our knees, padding the knee joints. And, we want a little bit of a strength there, especially let's say you're running the New York City Marathon or something like that. Yeah, you would want the cartilage in that area to be very tough, which is what the fibrocartilage does. And we also find in pubic bones, holding your hip bones together. Some people do splits. Some people are really great dancers, and this is why, your hips are not disjointed by just, while you're dancing. And the last type of cartilage tissue we have is going to be elastic cartilage, and like the name implies, is going to be bend very easily. We're going to find this in your ear, your external ear. If you can just move your ear, your epiglottis. The epiglottis is the one that closes off your trachea so that when you swallow, food doesn't go into the wrong pipe, the trachea. Instead, it's going to go down your esophagus. So one of the things you're going to see about cartilage is that it looks like googly eyes. I hope everyone sees that, all right? It looks like googly eyes. I especially like hyaline cartilage because I feel like this is like the quintessential googly eyes, all right? So it looks like googly eyes. So do not confuse this with adipose tissue. A lot of students tend to do this. Do not confuse cartilage with adipose tissue at all. All right, so that's all I'm going to talk about the cartilage tissue. On to bone tissue. Bone tissue, very unique. Okay, bone. We're going to be talking about bone on another. There's a whole chapter, bone histology, but this is just a brief introduction to that. So it contains the calcified intracellular matrix, calcification. That's what we call it. A lot of calcium salt deposit. We're going to when we get to bone histology, we're going to find out that it's not just calcium, phosphorus is also there, but I don't know, for one reason we'll just call it calcium salts. And bone resists shattering. So flexible collagen fibers. Someone might say flexible. My bone is not flexible. Yes, because it's also going to have collagen fibers. It's a connective tissue, so everything that I've kind of talked about will be there as well. And for weight support, So this is what bone looks like. It's going to look like tree rings. Okay, tree rings, and you're going to see, a lot of people might look at bone and say, wait, bone is not vascularized, but guess what? We see right in the middle, this red and blue are vessels. The red is for artery, the blue is going to be for veins. And then we see them right smack in each of these, what we call like osteon, which I'm going to talk about. The rings are the lamellae. So we can see a round ring here, a straighter ring here, and bone cells are called osteocytes. I forgot to mention that cartilage cells are called chondrocytes. All right, cartilage cells are called chondrocytes, just like adipose tissue. Adipose cells are called adipocytes. But you know, when you see this round tree ring pattern, this should tell you that you're looking at bone. No one should see this and say, "Wait, is this blood?" No, or is this fat, or is this dense regular connective tissue, or reticular? No. So one of the unique things about studying histology is that, you know, like I said, knowing what it looks like, so that when something goes wrong, you know, which is pathology, when someone gets a biopsy, again, I mentioned this at the introduction, we are looking at what looks different. If something looks different, if something's supposed to be round and it starts looking like a square, then there's a problem. All right, so this concludes the chapter, the connective tissue topic, and I hope you learn a lot here, and I will see you in my next video. Bye.